Today I am going to discuss about temporal fossa. So here you can see the lateral view of the skull. This view of the skull is known as norma lateralis, or the lateral view of the skull is known as norma lateralis. So in the temporal fossa, what all we are going to discuss is that we will discuss about the boundaries of the temporal fossa. We will discuss about the floor of the temporal fossa. We will discuss about the walls of the temporal fossa. Before discussing about the boundaries of the temporal fossa, let's discuss about the temporal lines. So you all know that the temporal line begins at the from the zygomatic process of the frontal bone. It runs upwards, it crosses the frontal bone, crosses the coronal suture, it runs on the parietal bone. On the parietal bone there are two temporal lines, the superior temporal line and the inferior temporal line. When traced posteriorly, the superior temporal line fades away and the inferior temporal line continues downwards and forwards, and it merges with the supramastoid crest. Here you can see this is the supramastoid crest. The inferior temporal line continues downwards and forwards, and it joins the supramastoid crest, and the superior temporal line, when traced posteriorly, it fades away. Okay, so this was about the temporal line. So now the boundary of the temporal fossa, the superior boundary of the temporal fossa is formed by the superior temporal line, and inferiorly we have the zygomatic arch laterally and the infratemporal crest of the sphenoid bone medially, the infratemporal crest of the sphenoid bone medially. So this is the boundary of the temporal fossa. Now the anterior wall of the temporal fossa is formed mainly by the temporal surface of the zygomatic bone. Then we have the frontal bone and the sphenoid bone, the frontal bone and the sphenoid bone. This anterior wall separates this temporal fossa from the orbit. It separates the temporal fossa from the orbit. Okay, this anterior wall separates the temporal fossa from the orbit. Okay. Now, regarding the floor of the temporal fossa is formed by four bones: the frontal bone, parietal bone, the squamous part of the temporal bone, and the greater wing of the sphenoid bone. Okay, frontal bone, the parietal bone, the squamous part of the temporal bone, and the greater wing of the sphenoid bone. Here you can see on the floor, at the junction of all these four bones, you can see the H-shaped suture is present. This suture is known as the pterion. This pterion corresponds to the anterolateral fontanelle in the fetal skull. This pterion, or this anterolateral fontanelle, fuses at the 3rd month of age. Okay. The location of this pterion is, it lies 4 cm above the midpoint of the zygomatic arch and 2.5 cm behind the frontal zygomatic suture. Okay, so this pterion is very important because the bone here is very weak or very thin. So in roadside accident, what happens is if any fractures occur at this level, at this area, then what happens is that below this suture there are certain vessels which run. The more important vessels are the anterior division of the middle meningeal artery, middle meningeal vein, and the lateral sulcus of brain lies here. So any trauma over here will lead to rupture of these arteries, and thus extradural hematoma occurs, and this extradural hematoma or clot of the blood will compress this side of the brain, and due to the pressure on this side of the brain, paralysis of the other side of the body will take place. Okay, so this is very important.